Greetings, my name is Brandy Christensen. I'm the HR manager for the City of Rapid City. We'd like to welcome you to the employee meetings for the benefit transition from the First Administrators, Inc. to Wellmark Blue Cross and Blue Shield. We're happy to be sharing this information with you today. It's great information. We hope that you'll find it helpful. In the event that there's anything that is not covered in the presentation over the next 40, 45, 50 minutes or so, we definitely want to make sure that you understand that you can reach out, ask your questions, get further clarification on any information that isn't clear to you after the information shared with you today. We are going to talk about two main areas with this transition from First Administrators, Inc. to Wellmark Blue Cross and Blue Shield. There's going to be some changes to the medical or the health care plan, and then also some changes to some of our covered employees on the dental side with this transition. So we'll be talking about both of those topical areas. With us today as part of the presentation, we have Alice Wilson, who is with Wellmark Blue Cross and Blue Shield. She's our account service rep that's assigned to the City of Rapid City for the duration of our relationship with Wellmark. We also have Jennifer Hertz, who has been our long-standing partner with First Administrators. She's our account manager. She is also heavily involved in the transition and will continue to help support as we move forward. And so they'll be sharing the bulk of the information today. Following Alice's presentation and the information that Jennifer's going to share with you, I'll share a little bit more about the changes that affect dental. So with that, I'm going to go ahead and turn it over to Alice Wilson.
Thank you, Brandy. This is Alice Wilson from Wellmark. Thanks for taking the time to listen to this presentation today. We do hope you find it full of information and informative. And as Brandy mentioned as well, should you have questions that we just don't cover today, then we want you to bring it to someone's attention so we can get those answered for you. So here's our agenda for the day. We want to talk about your health plan basics. We're going to talk about networks, your preventive care benefits, what your ID card will look like. We'll talk a little bit about the EOB as well. We'll probably spend the majority of time on drug plan basics, that next category that you see there. And we'll go over your specialty programs, step therapy programs, prior approvals, quantity limits, and any engagement options that can be there. There's a benefits enrollment guide. I should have said that first, and thank you, Brandy. We have a benefits enrollment guide, and throughout this presentation, I will reference a page number for you. So again, the enrollment guide is not the presentation, but it is a great reference point of any of this information that we're talking about, and those are available at HR. So please see them to get one of your enrollment guides. Moving on with that agenda, we're going to talk about health and care management services. We'll talk about the My Wellmark website, which you'll love. We'll talk about Blue 365, and then we will turn it over to Ms. Jennifer to talk about the flex benefits today. All right, well, you're going to come to know and love our access and our networks. Our provider networks are amazing. As you can see in the slide, we've actually just tried to highlight some of our strong points. Looking at the state of South Dakota, you can see that we do have 100% of the hospitals that participate in our network, and we have 99% of the physicians. We refer to our network as a PPO network, which means Preferred Provider Organization. So you'll hear that acronym used throughout the presentation. It's always nice to have a good definition behind that. Nationally, you can see that we do have 90% of the hospitals, 80% of the physicians. And if you travel or live outside of the United States, we also have a network in over 200 countries throughout the nation. If you look in those enrollment guides that we just referenced that you're getting from HR, page 15 really speaks to our network. So if you want a good reference point of where to go for network information, page 15 will have that for you. Page 19 speaks to our pre-certification, and we should take a little bit of time to talk about pre-certification for those of you new to Wellmark or coming on new to Wellmark. If you see a doctor in South Dakota or Iowa and they are helping with your care, a doctor will take care of that pre-certification process for you. If you need to have services, surgery, hospitalization, a doctor will take care of those prior approvals for you. If you need to have services outside of South Dakota and Iowa, so maybe your doctor says you need to go up to Minnesota and see a doctor in Rochester or Mayo. Once you leave the state of South Dakota, or if Iowa, if we're talking about that, you will need to take care of the pre-certification piece of your stay. So you'll need to make sure that you talk with your doctor and ask if those services are being handled by them or if you need to take care of those. So page 19 in your enrollment guides do speak towards that that pre-certification for services. Page 21 will talk a little bit about that Blue Card network. Blue Card is the network when we go outside of South Dakota and Iowa. So those pages there will reference that for you. We love to look at the Midwest coverage because, again, you'll see that Wellmark has that strong presence. Something to point out is that your network has been the same with this transition from from FAI to Wellmark. The provider networks have always been the same in South Dakota and Iowa, so that's something that you can also be reassured. If you're seeing a doctor today, you'll be able to see that same doctor tomorrow. So here's what the Midwest looks like with regard to the percentages of participating. And if there's any other states that you're interested in, please see HR who can reach out to us to get those numbers for you. All right, I think this is a great part to start talking about that health plan basics. And you'll see there just highlighted bright and in orange, there are no changes to your current plan. So what we really try to do is we've really tried to be that partnership with this FAI transition to make sure that your benefits are coming over as smoothly as possible. So you'll see there are no changes to the basic bones here of your plan. Your deductible, whether you're in or out of network, for a single person is that $300, and it's $600 for family. You'll notice there's a note, your deductible runs calendar year, so every January, that deductible will start over for you. Once you've met your deductible, you do fall into what we call a coinsurance category. A lot of people ask, what is coinsurance? It's that cost-sharing percentage. So you'll see in network, it's listing at 30%. That means you pay 30% and your health plan picks up the other 70%. If you go out of network, you pay 40%, but your health plan still picks up and pays 60% of that. These are amazing benefits. Your out-of-pocket max, if you stay in network, is $1,500 for single, $3,000 for family, and you'll just notice on that next column to the right there, out-of-network benefits, the most you would pay for major medical services out of network is even at $2,000 single and $4,000 family. Again, incredible benefits. Office services and your emergency services, you'll note no changes there. There's a co-payment followed by deductible and applicable coinsurance, whether you're in or out of network. That's what we're referring to there. And then we'll talk a little bit about your preventive and routine care services. You'll notice there is that $200 per benefit period. Preventive services then will apply coinsurance. We'll waive the deductible after you've met the $200. So again, just great coverage, really encouraging you to go have those preventive or routine care services. For a good reference point of where you can find this information in your enrollment guide, if you look at pages 9 and 10 in your enrollment guide, you'll also see a snapshot of what a very high-level overview of your benefits look like for both your health and your drug. Oh, we do want to take just a moment here and just mention too with the Rapid City ER docs. Rapid City Regional, and this is the same as it is today, but a little bit different in how that's handled. The Rapid City Regional emergency room doctors are currently not in the network. So we still pay at the in-network benefit level, but there could be a chance that there is balanced billing should you seek services there. I always like to just point that out in case there's a surprise there. And again, just knowing before you go is always, knowledge is power. So let's move on to preventive care. And then what we tried to do here is we tried to really outline that first $200 benefit that you receive, how that works. So a lot of things can be lumped into preventive care, but you'll notice that one physical exam, and this is per person, per benefit period. You get the separate gynecological exam, and immunizations all roll up and are included in that $200 first dollar benefit. This is a great benefit, and there shouldn't be any excuses on why you're not having that preventive care. This applies to everyone, gentlemen, ladies. Also, under preventive care, you guys receive 1 mammogram per benefit period. You have pap smears, the prostate screening, labs. There's smoking cessation consultations that can be considered preventive care. And you'll note there that well child care will go to age 7. These are all benefits that will then apply your deductible and coinsurance. What isn't included in preventive benefits, you'll see there hearing aids, hearing exams, and vision exams are all excluded out of the normal health plan, and that is just as it is today. All right, so let's talk about what your ID card is going to look like. This is the time where we like to mention that currently, when you receive an ID card, it's sent to the HR department of the City of Rapid City, and then they, in turn, make sure that you receive your ID card. And moving forward, as of October 1st, when an ID card is issued from Wellmark, those ID cards are going to come straight from Wellmark, and they'll be mailed to your homes. So this is what they'll look like. You can see a front and back there. Also, just to note that the enrollment file that's coming over from First Administrators is scheduled to come over on September 10th, which is tomorrow from the date of this recording. So those of you hearing this maybe after that date, good news is the enrollment is being processed. The enrollment, once it's in our system and QA'd, those ID cards are going to be mailed to your homes as soon as possible. So some things to note about that ID card. Your plan is called Blue Select, and you will always see that on the front of your card. You'll also see where we make reference to that PPO. There's that fabulous acronym again. All cards are issued in the name of the policy holder, and that is the same as it is today. And family contracts today will receive 2 ID cards on first issue. As many other additional ID cards as you will need, you can just call into customer service. You can go online to wellmark.com. You can also download our smartphone app, which we'll talk about in a minute, to get a temporary ID card at any time. You'll also note on the back of your card all of those important phone numbers. So customer service, blue card providers, the pre-certification that we spoke about. We'll talk about pharmacy in a minute, but there's also pharmacy information on the back of that ID card. Every number that you will ever need and relates to your health or your dental, your drugs, will be on the back of that ID card. So what a perfect lead-in for me, because we are going to talk about drugs next. And again, we want to make sure that we point out there's not any significant changes to your drug benefit structure. That is as it is today. So what you're seeing in front of you there with your Tier 1 and your Tier 2 coverage at the 25%, specialty drugs also fall under that 25%. And then you have an out-of-pocket max, and that's per member of $3,000. This is a great benefit plan as well. We don't get to see too many of these, so it's nice to be able to talk about that today. What is new about your drug program is the clinical programs. You might have remembered me mentioning earlier the prior approvals, the quantity limits. Those are things that we want to talk about moving forward in this presentation, so you know before you fill October 1st what to expect. All right, so in the enrollment guide, big chunk of this is dedicated to the drugs and our different programs that we have in place. So pages 23 through page 35 all reference different pieces of your drug health plan moving forward. So just as a point of reference, if you want to look over those pages, we'll specifically reference those in a minute. All right, if you purchase a Tier 2 drug when there is an A-rated generic drug available, you are responsible for paying your payment obligation for that equivalent to generic plus any cost difference up to the max allowed fee for the brand name drug. This, what we call dispense as written rule, is in place today, but we always like to go over how that works and what that means to you as far as the member who has this coverage. So we put together a few examples for you so you can actually see how this works. So the example that you're looking at in front of you is orthocycline 28, and this drug does have an exact generic Mononessa. So what we tried to do on these examples is we tried to pull the Wellmark drug list page as you as the member would see it. So you can see where we pulled up the orthocycline, and you can also see the generic name is in green and it's bolded, meaning that it has that A-rated or generic alternative available, exact generic alternative. So we put together some prices for you, and these are subject to change. They're not set in stone, but for the example today, we wanted to see a big picture. So the orthocycline is $61 at retail. The Mononessa is $16 at retail. The difference, $45. So you can see in our example, you'd pay $4, it's 25% of the $16, plus $45, which is the difference in price. It totals $49, and this is just for a 28-day supply. So if you want the brand, it's not as big of an impact on your pocketbook, but you can still see where that price difference comes into play. If you were to go with the generic, you'd pay $4. So a great example of how that, you still have the choice. We're not saying you can't have that drug, but a good way of how it can impact you, and there could be a cheaper alternative for you. When the cost of the drugs go up a little bit, it does make a bigger impact. And so what you're seeing here is our example number 2. This is the Diovan HTC, and it also has the exact generic, which is the Valsartan. So if you look to the left of your screen, that's what our Wellmark drug list looks like. If you were to go out there today and pull up a name of a drug, it's green bolded in the generic name field, which means this is one of those exact generics. Diovan HTC costs $226 retail. The Valsartan, $91. You can see the difference there. We laid out for you the $135. If we did our math correctly, you'll see the Tier 1 coinsurance, 25%, gives us the number of $22.75, but then you also pay that difference in price. So it would be a total of $157.75 for a 30-day supply if you chose the brand name drug in this case. If you choose the generic, you'll only pay the $22.75. Something that we've been pointing out in all of our examples is when there's an exact A-rated generic like you're seeing here, your pharmacist can automatically switch them at time of fill. So maybe you're thinking you're getting the brand, and all along you've been getting the generic. So this isn't usually quite as big of a deal, but we always like to point out that it could happen. So moving along, we're going to talk about the specialty pharmacies right now. And Wellmark uses 2 preferred specialty pharmacy vendors. That's Caremark Specialty and Hy-Vee Pharmacy Solutions. If you currently are enrolled in a specialty pharmacy program with the current vendor, you will need to be aware that you need to pick. So you'll be picking between Caremark and or Hy-Vee, and you'll want to have that solution in place before that October 1st deadline. So in your enrollment guides, we actually have a list of drugs that fall under specialty. And this is going to be very important for those of you that do take specialty meds. So reference pages 27 and 28. And 28 really has the drugs that are actually part of our specialty pharmacy program. If your drug is on that list, we want you to be able to have a smooth transition, and that's why we're bringing this to your attention today, so you can have time with your doctor to get those scripts and all of your information moved over. So if you have questions there, this is usually where we do get some questions. This is where you will want to reach out to HR and get some of your questions answered if you're struggling at what to do. But the enrollment guide does go through the process in very good detail, so you won't be left hanging there. All right, moving on. If we look in the enrollment guide again, this is where we want to take you to pages 29 through 32. These are all drugs that may have the quantity limitations or, again, the prior approval, meaning it could be a step therapy drug, or it may just require that your doctor calls in before you're allowed to fill that medicine. With this transition from FAI to Wellmark, this is one of those things that we don't have the ability to receive this information over into our system before your go live date. So these are the drug lists that we really want you to pay attention to. If you look at those pages, if you have a drug that you are currently taking on one of those lists, this is where you'll want to reach out to your doctor to get those prior approvals called in to Wellmark. Now keep in mind the enrollment file is coming over tomorrow, and so we'll need a few days to get that loaded. So our goal is to have ID cards in your hand within 14 days from that time, but you can start working with your doctor as soon as next week to get those prior approvals called in so you don't have a disruption to your prescription drug coverage come October 1st. So reference those pages. Again, that was 29 through 32 for step therapy or prior approval drugs, and then the quantity limits are listed on pages 33 and 34. Mail order option. You do have mail order through Catamaran home delivery. In order to take advantage of this great benefit, you want your doctor to write out 2 prescriptions. Usually we do 1 small supply to fill immediately, and then 1 for a long-term supply to complete your probably refills throughout the year. There is more information in your enrollment guides on this as well. Page 35 goes through the entire process on how to get set up, who to call, where to go. So you'll want to reference that in your enrollment guide as well. We'll move on to the health and care management services. And this is one of those great pieces that I like to talk about being a Wellmark employee because it's something that we've believed in for a long time. The programs are set up to live healthier and focus on improving members' overall health. So you can see that we have a suite of services that all wrap up under this health and care management. The first one we love to talk about is the 24/7 nurse line. We love our nurse line because the folks on the other line have access to your benefits, meaning they can see that you have a copayment followed by deductible and coinsurance. The folks on the other line can also see where your accumulations are at. So how much of your deductible have you met for this plan year, and how much do you have remaining? These nurses also have access to your explanation of benefits, and they're your gateway to get into other services within Wellmark. You may want to program your cell phone. You might want to call it the My Health Questions, and you might want to just put that phone number right into your phone. Also, if you download our app that we mentioned earlier, and we'll mention again, but you can download the My Wellmark app and also have instant access to that 24/7 nurse line. Part of this nurse line, and like we mentioned, the gateway into another program, if you call into the 24/7 nurse line, you'll have access to what we call as, or refer to as, a health advocate. Health advocates are going to be your results-driven folks. If you have received a stack of medical bills or just completed a really complex procedure and you need help muddling through that information, we all know health insurance can be very confusing, so a health advocate can be there to help you walk through that process. We've had folks that needed to transfer medical records. They needed to get their x-ray or lab results. Maybe they need to coordinate multiple appointments within one day. Maybe you're dealing with a loved one that just got diagnosed and you need to just get some other information. This health advocate is a great perk to having benefits with Wellmark. And again, it's just built right into your health plan. Our care management piece of our health and wellness tools is something that we're also very proud of. You'll hear me say that over and over again, that we're just proud of this program. This program is going to reach out to folks that may have been newly discharged from a hospital after a major procedure. Or maybe we just received a claim in from a health provider that indicates there could be a traumatic life experience going on. And Wellmark is going to call you. This is one of those things that it's a personalized telephone call from someone on the other end that, again, has your information, someone from Wellmark being your advocate working with your provider. Now, you don't have to work with us. You don't have to speak with us if that's the route you choose to go. We encourage you to pick up the phone and call and let someone know your intentions there. But if Wellmark is calling you, it's not usually for a bad thing. It's because we're truly trying to help coordinate that care with your providers and with your family. One other reason Wellmark may be calling you, especially in the next 90 days, we'll be calling to reach out to you to verify if you have other health insurance. One of the things that we do is we partner with a vendor that helps make outbound calls to verify members' other insurance information. We'll definitely be receiving what we get from the FAI plans and what you currently have on file, but if we notice that it needs to be updated or we need to get some current information, we will also be making outbound calls to you to verify that information. And our reason for doing that is to make sure that we process claims right the first time, that we don't have to go back 6 months later when maybe you did have other insurance and have to recoup and reprocess all those claims, creating a large mess for you. So Wellmark will be calling. I would highly encourage you to pick up the phone and talk to one of our representatives. All right, we're going to move into the My Wellmark Portal. And we want you to see what it looks like when you go out to Wellmark for the very first time. So this is a screenshot of what our home screen looks like. And you'll see we've got arrows all over the place here, but if you focus in just the top right hand, the login to Wellmark place, the register now is located right below that blue login box. And this is where we all want you to go once you receive your ID cards so you can get registered for that instant My Wellmark access. We have all kinds of tutorials, tours, how to customize, all kinds of different things if you're not computer savvy that will help you become more computer savvy, at least when it comes to the My Wellmark page. So the first part is getting set up. The second part is just verifying your identity with us. It's a two-part process. So we partner with Ideology to make sure that we can get some good verification questions out there and in place. Some of the questions can be a little personal. For example, we may ask you your addresses we might give you a multiple choice question on your addresses for the last 10 years, and one of them may not be one of your addresses. This is information similar to what you could pull on a credit bureau, but it is not that in depth. We do not have access to that. But if you answer those questions right the first time, you have that instant access to your personal health information. We call it PHI. So we have to make sure that we're speaking to the person that says they're you. So we want to make sure that it's you. In the event that maybe you can't remember your addresses for the last 10 years, we will mail a one-time PIN that comes through the mail to your address in that 7 to 10 day time frame, and you can just go right back out to My Wellmark and put that PIN number in, and you'll have that access that you need. We always like to inform people of that so they don't think that we're taking any information from them. We try our best to protect your information at all costs. Once you complete that login process, the screen that you're looking at now is actually the home screen for My Wellmark. And you can see that each of these widgets or boxes that have a different color can be moved around and sorted. You can add notes to your claims. You can pull up EOBs. There's just a plethora of tools here. I can do employee meetings and talk about just My Wellmark for hours, but we won't go through that today. We just want you to be aware of what you have out there for tools. The cost and quality tools are amazing, so if we can point you into some directions to help navigate and help make informed choices, that's really the goal of My Wellmark. Here's the absolutely necessary app that I was talking about. Once you receive your Wellmark ID cards, you'll definitely want to add this app to your smartphones, your iPads, or even your home computers. What you can get with this app is you'll get your doctor and hospital finder. You can get an electronic copy of that ID card, and you can actually get instant texts and messages sent to you regarding information that you may have had a question on. So the Ask a Nurse 24/7 nurse line is also available here. This just becomes a great tool for those of you that are looking to get advanced technology. We definitely have what you're looking for here. Blue 365 is the last piece that I get to talk to you about today. And what this is a member discount program. Your Wellmark ID card is actually the ticket to these great perks. What I like about Blue 365 is that it's discounts that you would normally not see on items that are important to you and your family, but may not be covered under your health insurance. I always like to use hearing aids as a great example. Hearing aids are they're not covered under your health plan, but through Blue 365, you can receive additional discounts by using vendors that participate in this program. All of the contact information is on this sheet, and you'll be able to find that online through your HR portal or also online, and you'll notice there that we put a nice little widget that you could actually add onto your My Wellmark page and have instant access to those discounts. This concludes my part of your presentation today. And as I mentioned earlier, just please review those drug lists. Those are usually where we see folks probably have the most heartache when they change carriers, and we just don't want anyone to have a heartache today. Look at those enrollment guides, review your provider statuses, make sure your providers are all in network, which we're all confident that they will be, especially if you're seeing them today, and ask those questions. So again, invitation to reach out to Human Resources if we did not cover something that we needed to cover today. I did just remember something that is very important, though, and the deductible credit. So with this transition, we will be getting a deductible credit report. So if you've already met your deductible on the FAI plan that's moving over to Wellmark 10-1, we will be receiving reports to load those deductible credits for you and your family members. So be patient with that process. The first report should be loaded before the October 1st timeframe, and then we will receive a second one that will be loaded within 90 days to get that information updated. So once you receive those new ID cards, just please remember to show the providers that you're seeing the new ID cards so your services are not denied. This concludes my portion. Thank you for listening, and I'm going to turn it over to Jen Hertz now.
Hi, I'm just going to talk a few minutes about the transition for the flexible benefits plan, which is your medical reimbursement and dependent care reimbursement plans. Those plans are also transitioning to Wellmark effective October 1st, and there's just some key dates that you need to be aware of. The last claim run that First Administrators is going to process for your claims is going to be September 16th. So basically what that means for you is if you don't have a flex claim into First Administrators probably by the week of September 9th, so maybe by the 11th or the 12th, I would suggest you hold on to it and then submit it to WageWorks to be processed after they're up and running on October 1st. The final claim run, the final EOB or direct deposit that you will get from your flex plan from First Administrators will be distributed to you on Friday the 20th. But going forward, you will no longer receive checks from the finance or HR office on your flex reimbursements. So just be aware of that change. You will also be receiving in the mail a flex debit card that you can use for any dates of service when WageWorks starts processing your claims. And the way that'll work is when we do our final claim run at First Administrators, we will transition all your information to WageWorks, which is the vendor that Wellmark uses to process their flex. And so if you have $500 left in your flex election for 2013, that amount will be loaded on the debit card that you receive. So you can use that debit card at the pharmacy, at the doctor's office, anytime you have to pay a qualified healthcare or dental expense. You can use it at the eye doctors or the dentists also. Anything that's covered under your flex plan, you can use that debit card for. And basically, it just takes that money directly out of your flex account without the need to file a claim. So when you do your open enrollments, which you do in November for January 1 of 2014, the card that you're going to receive is actually valid for 3 years. So as of January 1, whatever flex election amount you have for that year, that amount will be loaded on your card. You won't receive a new card, but it'll be available to you as of January 1 of 2014. So you'll have that amount immediately available to you after you do your flex election during open enrollment. The last thing to mention is there's going to be, well, two things. There's a 2-week transition period that First Administrators will be done processing claims and WageWorks will start processing claims. But since you're on a 2-week schedule right now, hopefully that won't cause too much disruption for people. And the final piece is, as you may be aware, First Administrators currently has an office located here in Rapid City in Founders Park. And we do have quite a few people that drop off flex or dependent care claims to our office every week, every other week. We do have quite a few people that walk in, and we're happy to help you, but with this transition to Wellmark, we're no longer going to be able to accept those claims since we're not processing them anymore. So just be aware that that's going to be a change. If you try to drop it off at our office, we'll direct you that you either need to file that claim yourself or you can take it to the HR office and they can assist you with filing that claim. So with that, I'm going to turn it over to Brandy, who's going to talk about your dental changes.
Okay, hello again. Thank you, Jennifer. So the last piece that we want to make sure that we cover with you today is the effect on this transition and how it may affect your dental coverage. And I want to try to be clear on that this change does not necessarily affect all city employees. The groups of employees that this will affect are the non-union employees, so those of you that are not covered under a collective bargaining agreement, who are enrolled in the city self-insured dental plan. It also affects any employees within the police department or fire department who may be covered under the bargaining unit there, but are enrolled in the city self-insured dental plan. For any employees that are currently on Delta Dental, this change does not affect you. In fact, this transition will have very, very little effect on you until we begin talking about open enrollment for the 2014 plan year. So definitely don't stop the presentation at this point if it sounds like the Delta change from the First Administrators to Wellmark doesn't affect you, because there's a little bit of information later in this presentation that you'll want to hear about. So please keep listening until we get to that point. So as we've already mentioned, effective October 1st of 2013, our healthcare and our dental is going to be affected. The transition from First Administrators to Blue Cross Blue Shield, we've already gone over the healthcare changes. And so how this is going to affect the dental plan is that essentially city self-insured dental is no longer going to be available. Wellmark Blue Cross and Blue Shield is not in the dental business, so they do not have the capability to administer dental plans. So that prompted some research by the city's healthcare committee. We looked for a plan that could be added in that would be as close to the city dental plan that we are losing coverage on as possible. And we found a plan with Delta Dental, and we're going to refer to this as the base plan because we want to try to avoid confusion considering we already have a Delta Dental plan that's been in place for many years. So this new plan, the Delta base plan, as I mentioned, the premiums and the services covered, et cetera, are going to be as close to that city dental plan as we could possibly implement. Now again, just as a reminder, this does not affect the individuals that are currently enrolled in the Delta dental plan that's been offered under the city coverage for quite some time. This also does have some effect on people who are considering retirement because we're moving away from a self-insured dental plan and moving to a fully insured dental plan under Delta. Coverage for retirees will no longer be available as it has been in the past. They may opt for COBRA coverage with Delta Dental as they transition out of full-time employment with the city or part-time benefited employment into retirement. However, it's just not available as it has been in the past. So if you're getting close to retirement and want to discuss this further, please feel free to contact someone in Human Resources and we can walk you through that process and how that will affect you. Because we are technically losing coverage under the city dental plan, we are holding a special open enrollment period for those employees who are affected, or put another way, for those employees losing city dental coverage. So for those of you that are in this situation, Human Resources actually sent out letters last week. Actually, in addition to the letters, there's enrollment information, et cetera, in a packet of information. So please look for that in your work mailboxes or check with your department if you did not receive one of those and you are on the dental plan for the city. But again, you should have received that if you're enrolled in the dental plan that is going away. So if you're covered under the city dental plan, that coverage is going away, you have the ability to make one of two choices. You may opt to go on to this new Delta Dental base plan, or you may opt to not be covered under dental. In your packet of information, you would have received both an enrollment form as well as a declination of coverage form. And we ask that by September 30th that you make your decision and return one of those completed forms back to Human Resources so that we can be sure that everyone that's affected by this transition makes a dental election. So again, by September 30th, please return either the enrollment form if you're opting to enroll on the Delta Dental base plan, or return the declination of coverage form. Moving forward in a couple of months, and this is where all employees will definitely want to perk up and listen to this information, not just those of us losing coverage on the city dental plan. During annual open enrollment period that comes November, December each year for changes effective the following January, all city employees are going to have the same three options. No longer is it going to be this work group has the option for this plan, but not this plan, and then this different work group has the option for this plan, but not this plan. It's actually going to be all city employees have the same three options. You can enroll in the current Delta Dental plan, the one that we've had in place for several years, this new Delta Dental base plan that we've just talked about, and I'll actually speak to the coverage levels and rates and things of that nature on the forthcoming slides. Or all city employees also have the option to decline coverage. For any employees that are losing that city dental coverage who also enroll in the Delta Dental base plan, if you opt to enroll in that plan as of October 1st through 12/31/2013, you may just continue on that enrollment into the calendar year 2014 without filling out a new enrollment form. It just will be viewed as Delta Dental by Delta Dental as a 15-month plan year. However, if you enroll in that Delta Dental base plan for October 1st through December 31st, you still may have the option to change to the current Delta Dental plan or no coverage at all. It's only if you opt to enroll and want to stay on through that Delta Dental base plan all throughout the course of 2014. So it's a little bit complicated to try to explain that. So if you have questions on that, please don't hesitate to give us a call over at HR or stop in. Hopefully that makes sense, but it's difficult when you're not in front of a live audience to know if there's any questions or confusion on that. So I'd like to talk a little bit about the differences between this new dental base plan that's offered with Delta versus the coverage that we're losing, so that you know these differences so that you can make your decision accordingly. For the new Delta plan, the rates are as follows. For the single coverage, it's $29.50 per month. For the two-party coverage, it's $59 a month. And the family coverage is $81 a month. So you can see there is a bit of a change in terms of the monthly premiums. The plan itself is going to cover you essentially the same. There are a couple of minor differences that we'll get into a little bit more detail on, but essentially it will still pay 50% on eligible services up to, on eligible services per member up to a maximum of $1,500 per calendar year. That's exactly the same as it was on the city dental plan. There is a $50 annual deductible per member per year, and there's also a $1,500 lifetime ortho max. We'll talk about those two changes in a little bit more detail here on this slide. So this deductible that I refer to, the $50 per covered member per calendar year, is actually limited to a max of 3 deductibles per family per year. So if you have 5 covered members on your plan, you do not have to meet all 5 deductibles. It's actually capped at 3 deductibles. So the most that you will pay for this deductible for family coverage is 3 per family per year. This deductible also does not apply to diagnostic, preventative, or orthodontic. So the time when the deductible comes into play is going to be when you get into the dental work, such as fillings, cavity repair, crowns, bridges, things of that nature. There is an orthodontic max that is now going to be in place with this new Delta plan. It's $1,500 lifetime max per family member. For those of you that may already have a case in progress, I encourage you to reach out and contact Delta Dental. The contact information is included in the packet of information that was sent out to you from Human Resources, but this information, as well as all of the information that we're covering today, can also be found out on the city website under the Human Resources section. But I encourage you, if it affects you, or if you're planning orthodontic services, or you're already in progress, or if this is just one of the changes that may affect your family, we encourage you to reach out to Delta Dental to discuss your specific case. But in particular, where that's going to come into play is if you already have a case in progress. You'll still be eligible for the benefit. However, you'll want to contact Delta Dental to talk about that, because each case is a little bit different. One of the key things that I also want to make sure that I mention is that while it may seem like premiums might be going up a little bit and that there's this deductible in the orthodontic, there's also a pretty significant benefit to moving to a network under Delta Dental, because if you're familiar with how networks work, typically there's going to be some savings or some discounts that are passed along from those providers that are part of the Delta network. So I can't tell you exactly how much it's going to be or how significant they are, but you should see that your general office visits and many of your services will be offered at a discounted rate because now the provider is operating under the Delta network. So that's a plus and some good news with this transition. So that concludes the actual prepared information that we have made available to you in this presentation. Again, I can't stress enough, and I believe that Jennifer mentioned it in her portion, as well as Alice mentioned it in her portion, that we've done as thorough of a job as we can to anticipate the information, to anticipate the questions that you're going to need to have answered, and the information that you're going to need to have available to understand as much as you can about this transition. But please do not hesitate to reach out to Human Resources. If we don't have the answer, or if that question or concern that you have is best responded to by somebody over at Wellmark or somebody at First Admin, we'll get you in touch with the right person that can answer your question, or we will go get the information for you and get back to you on that. But we thank you for your time, and we hope that the information has been helpful and that it aids you in your decision as we move forward. Thank you.